A very pleasant good afternoon to everyone.
Good afternoon.
Good afternoon.
It sounds like you guys are not happy that you're online. You want us to get into the classroom? Hello?
If I could teleport.
If you could teleport. All right. We had some plans for today, but from all appearances, other plans were laid that we weren't aware of. And as Murphy Law said, anything that can go wrong at the last minute. You would have been aware that we had some issues on campus with regards to power outages. And so we have all been sent online for today, which put paid to the plans that we had to do the determinants of health game. It's a game, but it's also a learning tool. But see, that is not going to happen. So we are going to look at our problem 3 practice topics. And then we are going to finish up that presentation that we started from last week. So without any further ado, who is going to take on that first one? Which group is taking that first one on? Hello? I don't like where you guys are quiet, man.
Hi, Miss. I can tell you what I have for it for the first topic. Hello,
Who is speaking?
this is April.
Okay, April.
Um,
Tell
so
us in,
the
tell us in September what you have.
okay, so the problem would be the high rates of unemployment and underemployment, especially among young people. The causes would be due to lack of finances for further education or tertiary education, which would lead to less formal employment or just no employment at all. Also, another cause would be discrimination by age and class that occurs within many organizations. So a lot of organizations don't really or are not willing to accept many young people within a certain age group or within a certain class. Another cause or another route would be the crime, which takes them away from a path of seeking work. Lack of resources to explore certain options. No work experience is also a cause, and limited job availability. Many of those are interconnected, but those are the roots that I had.
Okay.
And then the branches of what
The
occurs,
manifestation of that.
right, due to the high rate of unemployment and underemployment would be brain drain, especially for those who find that they have discrimination or less opportunity to work because they're told they don't have work experience. Many of them may seek opportunities elsewhere. Also, because of the high rates of unemployment and underemployment, you find that you have an increasing prevalence of mental health concerns, depression, amongst other things. Decreased productivity as a nation can occur as you have a higher amount of the young population instead of working, engaging in other activities. This also leads to, even though crime can take them away from seeking employment, crime can also be increased due to unemployment. So I found that that was one that was both well, I don't know. You would tell me if it can be both a root and a manifestation, but I think it can be. So unemployment does lead to increased rates of crime and violence as well. And the last one that I had was high rates of unemployment and underemployment in young people can also lead to political instability or social unrest if it's severe in some countries. That's what I had. I don't know if that answers it, but those were the things that I had.
All right. Can you elaborate a little bit more for me how crime is a root cause of unemployment or underemployment?
So, for example, in certain inner city communities, children are often, or younger individuals are often exposed to criminal activities and see that as a way of fast money. So they may not have formal employment, or so they don't seek employment, and they'll be classified as an unemployed individual. I don't know
All
if
right.
that answers. So they would rather, or they're exposed to crime at an early age and they engage in that activity instead of seeking employment. So they will be classified as unemployed. But then being unemployed can also cause other individuals to seek criminal activities, and as a result, it can also cause increased crime in a country.
All
So
right.
on both ends, I think crime can be a root, but also a manifestation.
All right. Thank you for sharing. Is there anyone else who had done that topic? Who else did that topic?
I also took a look at this.
Is there anything else that you have that April did not have?
No, miss. I only have like for the symptoms like it would be brain drain, but basically the same thing that she have.
So that's Francine. What about you, Veronica?
Not sure if I heard all of what Francine had. But in terms of the root causes, not sure if there was a inefficiencies in the justice system. I'm not sure if she had mentioned that.
How does inefficiency in the justice system
Right. So
contributes
what
to?
happened? High levels of crime. And so
Mm.
what we find is that we have a high rate of reprisals because you would be going to court for years and years and years, not achieving justice, and persons just think, okay, this is not working for me. Let me just take my own justice. And so that in and of itself, if you feel like when you go through the justice system, you are not going to get justice, persons tend to do reprisals, and that in and of itself pushes up the crime rate.
Oh, Miss, I think she did another problem topic, not the first one.
Because I was trying to put those two
Oh,
together, and I was not. I was asking about those who did high rates of unemployment and
oh,
underemployment among young people.
okay, miss.
All
Wrong.
right. So apart from Francine, who else, and April, who else did that topic? Nobody else did that topic?
I did
All
topic
right.
3.
Pardon me?
Topic 3.
All right, so let us move along then. Our next topic was high levels of mental health stigma and low access to services. Who want to start off with that one? Somebody who did
Miss,
that one.
I did that one, miss.
Okay, then Nadine, go ahead.
Okay, so for my causes or the roots, it was negative cultural beliefs about mental health, such as taboos. There was lack of public awareness and education about mental health. The influence of religious or moral interpretations, where persons view mental illness as an actual punishment. Fear of discrimination in the community, such as schools or workplace. There were also structural factors, which included shortage of mental health professionals, such as psychiatrists, psychologists, and social workers. There's an unequal distribution of services, whether it be urban versus rural areas. There's also limited funding for mental health care, inadequate integration of mental health into the primary health care level, and weak policy implementation and enforcement. There's also individual factors, which included low health literacy, fear of being labeled or ostracized, and financial barriers, whether it be the cost of treatment and medication, and to have access through transportation. Now, as it relates to the symptoms or the consequences, They are categorized into health consequences, social consequences, and economic consequences. So, in terms of health consequences, there's delayed diagnosis and treatment. There's also worsening of mental health outcomes or conditions. There's also increased comorbidities such as substance abuse, suicide risks increased, and physical illness. With regards to social consequences, there was exclusion from education, employment, and community life. There are broken family relationships and social isolation. There's increased violence, crime, and homelessness among untreated individuals. And economically, there's loss of productivity and income. There's a higher healthcare cost in terms of hospitalization and emergency care, and national economic burden due to untreated mental illness.
You're
So
finished
that,
now?
yes, Miss, for now, yes.
All right, very comprehensive. There was one cause of mental health that I didn't hear coming out, but it is some very prominent in some communities where rather than to seek medical care, they attribute this as the cause of the mental health, and so you may often find that they don't seek the kind of care that
Do
they
you
ought.
mean Obia, Miss?
Yes, how can you leave that one out?
Uh, yes.
Yeah, somebody do them something science and something, so that is what they attribute as maybe one of the cause. You did mention though that there was a lack of integration of mental health in primary health care. Are you sure that is still the case as we speak?
Well, honestly, at a primary healthcare level, I'm not that versed, so maybe one of my colleagues could assist me in that regard. But even if it should be the case, I don't know if they're moving as fast as we would need them to.
All right.
Actually,
So,
if I may, I could shed some light.
okay, go ahead, Vanetta.
Yes, mental health services have been integrated into the primary healthcare setting. Actually, in all our regions, we do have mental health clinics. They serve usually out of the standing clinics on certain days, particular days. And they are very well utilized by the community, by those in need. They also, in addition to the clinic activities, they do have what you call crisis intervention and home care. Now, these deliverables are hampered oftentimes by lack of resources. So I would say they're not as effective as they could be because of that, but they are there and they do help. So I've actually witnessed where community persons would call in or come in to say there is such a situation where this person is acting out in this manner, whether it's a known case or unknown, and the team from that department responds. Depending on the nature of the crisis, it's an immediate response, or it can be one that is planned for. But as I said, what we find happening sometimes that hampers is the lack of resources. And by no means does it cover the magnitude, but it is there. And the lack of mental health officers, social workers, and psychologists, also the human and physical resources. That's what is hampering how
reach.
well the primary healthcare mental health services could do. So
Thank you
their
so much for that,
efficiency.
Vanetta.
Miss,
Because I
oh, go ahead.
somebody was just speaking.
Yes, April. I was just saying that even, as she said, even though you have mental health teams that are coming to the clinics. As somebody who also works in primary care, for example, where I work, they only come 2 times for the month. And for the magnitude of mental health patients that are here, that's just highly insufficient. So really and truly, there needs to be a bigger push for more psychologists or more individuals to come on board in a primary healthcare setting. Because if you have a patient that shows up and is in need, me telling them to wait until next month, or me trying, I would have to, sometimes I have to stop and try and find out, okay, can they go and still be seen where the team is at another health facility today, but what is the load of that facility itself? It's not always the easiest. And then when you have some instances where you're in need of the crisis bus, to be honest, that's not always available either. Sometimes you have to get the police involved, and the police are telling you they're not trained to manage a mental health patient. So integration could still be a little bit better. We definitely have things in place, but the resources are just so stretched and limited in the primary healthcare settings. It all boils down to the lack of resources, to be honest.
All right. And thank you so much for that. And Nadine, we do have a good integration. But as your colleagues would have shared, it is the paucity of resources that is hampering the extent to which they are able to fulfill that mandate. And remember too, that the government for many years has been having this push where they spoke about community mental health, where they want the persons not to be housed or hospitalized at Bellevue, but to remain within the community and be treated at that level. And some of the efforts that they would have made to facilitate this, they would have employed or trained more mental health officers, as well, I know for St. Catherine, for the Southeast region, they had buses that were specifically assigned to the mental health services, and it wasn't used for anything else, or should not be used for anything else. And that would allow for them to do their home visit or the community interventions that would have been required of them from time to time. They were also given cell phones, and so those numbers were made available for persons to call. One challenge though is that sometimes you call that number, it continues to ring without answer, or it just goes straight to voicemail. So I'm not so sure what is happening with the telephone system, but efforts have been made. But as was outlined, there is still a very far way to go to it being where it ought to be. So go ahead, Vanetta.
Just to add a little to that, all of what you said right there, lack of resources, but also some lack of insight. Because where the push is, and my colleague who spoke of the fact of the community, the stigma is there in the topic, and she highlighted on it, is a very real thing, and it is one of the greatest hampers that why the integration of getting them out of hospital into the community, because it's a reality. It is a reality. When a person who is experiencing a mental illness crisis endangers someone, causes harm to someone, how do you get that family, even after an extended period of treatment, to accept that, knowing that, given the condition they have, they can relapse? How do you get that family to be comfortable with that person in their home again, sleeping and being just operating as normal, knowing that if things change, they can then become violent again also. And
that's a real
it is
situation.
very,
we are
very
talking
real.
about.
And to
it-
date, it
they
is why
pushing-
so many persons are still at Bellevue and not home.
And they have been pushing for community mental health. Not just the police alone do not have that training to handle the situation, but the community members themselves do not know how to handle the situation at that level. And in recent time, it was last year, where a number of persons, including police officers, were injured
And killed.
Yes, because of persons of unsound mind or persons who have mental health challenges. So they do I think out of, especially out of what happened last year, more than one police officers were actually attacked by persons with mental health issues. And if I remember correctly, one had actually died. So those
Yes.
situations were there. And so the government would now need to go back to the drawing board, look at how do we beef up the capacity at the community level to handle the situation. I know we are deviating a little bit because of the whole bit of the mental health, but it is one of those areas that is of serious concern that often get pushed aside. So I'm happy we can spend some time here just looking at it, because as public health practitioners or wherever you work, you will come across persons with mental health issues. There were 2 cases here in Portmore. One where the young man was very boisterous and he refused to take his medication. His mother was elderly and they keep asking for assistance to get him into treatment. Nobody was giving them the time of day until one day he decided to trash a police car. And that was how he ended up at Bellevue. A few months after he was there, after he stabilized, they called and asked the family to come and collect him. By that time, the mother had passed and nobody would have been at the house. And I don't know that they had gone to collect him because they themselves not know what to do, how to manage the situation. Recently, again, we had another case where the young man really trashed the house like crazy. The mother had to leave and go stay by her daughter. And it took us several weeks to be able to get him into Bellevue for care. So we do have those situations where it is hard to be managed at the community level as is desired because of the lack of resources. And Bellevue don't really want to, the government really want the Bellevue thing to scale down. And I guess part of it has to do with the amount of the cost of caring for them while they are there. The 3 meals per day. I don't know, it is a medication. It might have been the 3 meals per day that can cost a lot of money, as well as the other overhead expenses that have to be taken into consideration when they are in the facility for care. So we do have some of those issues. And I do hope that we will engage some more with the whole business of mental health, and not just for those who are elderly or older, but we have to look at what is happening with the younger population. And it should be told, sometimes some of the behavioral things that we are seeing, you really wonder if mentally something is not wrong with some of these youngsters. So we do have those issues that we have to keep at the front of our mind as we go through. Did anybody else look at that particular topic?
Miss, I just want to ask a question. That's Badal. Per community or sections in Jamaica, is there enough psychologists or psychiatrists available?
Not that I know of that we have ever had enough persons in that field employed to do what needs to be done. So often you find you have 2 or 3 psychologists and they have to span a whole parish and sometimes also provide service at the hospital. So it's a field that is understaffed, and I don't know what is being done.
Since we are on this topic, Miss, the reason why I ask this question is because I deal with renal patients, and I got a call today saying that there's a patient of mine where the person called me and said that their daughter is writing in the book that she wants to kill herself. And when the father found out, he said that she said that to the father that it was just a joke. Now I had to explain to him that the things that the children are watching right now subconsciously is affecting them. And I told him he needs to refer the child to their psychologist or psychiatrist. However, he said to me that it is difficult to get in contact with someone to assist him. That is the reason why since we are on this topic, I mentioned this, because when I actually called someone I knew of to assist that person, they are giving me like 2 or 3 months appointment.
Yeah, the waiting list is very long.
He
Yeah, it is
can,
very,
but
very
he
long.
can carry her to a health center if it's somebody that will, who is open to being seen in the primary care. He can carry her to a health center, and then one of the doctors in the curative department will refer her to the psychiatrist there. Depending on the age of the person, then it might not be at the same facility, but he can go to a primary healthcare facility, any clinic, on a date, explain to them what's going on, and the doctors will see and then refer to the psychiatrist.
Okay, okay.
Because I
Thank
was
you.
Or
about to
try and
say that
call the
if you have
psychiatrist
mental
and tell the
health,
psychiatrist what the situation is and ask for them to facilitate. The psychiatrist that works at my clinic is the same psychiatrist that works at over 10 other clinics, but you can still try and speak to them and see, you know, what your best option is and have the child at least be seen or referred to. Because it's there are difference of adults versus children, but at least for them to go to the clinic and then be referred where they need to go.
Okay. Thank you for that.
because I
Yes.
was
In
But
about to
addition
say
to
that the
but
that,
primary care facilities do have mental health clinics. And so what you can do, Dr. Badal, is to appraise yourself of the times that the days and when they do have those clinics, because you never know, you may come across that situation again. And one of the whole basis of quality healthcare is it is you being able to direct them to where they can get that other care that they actually need. But we do have mental health clinics at the various health centers.
Okay, thank you very much.
Excuse me,
sorry,
Miss. I'd like to
Miss,
just
can I?
add for Kingston specifically, because he said it was a child. We have child guidance clinic, so he could actually refer the child directly to comprehensive,
Right.
to the child guidance clinic at comprehensive, and they will usually they accept referrals every single day, and then they based on the case, then they will decide who will see the client. That's how we usually do it. So if it's in Kingston and St. Andrew, I know there's child guidance and there's also child guidance at Glen Vincent, but it's once a week. But comprehensive definitely accepts patients every day.
Okay, okay. Thank you very
Thank you so much, guys, for that information. Also, knowing KPH's situation, we don't have psychologists at KPH. And for a place that is catering to cancer patients, on top of everything else, it is such a great need to have these trained type persons in our setting. We only have 2 social workers, and it is so hard for them to even give time to our area that we treat patients, see them on a daily basis, and tell them a diagnosis of cancer, which is quite hard to break down and tell someone. And so I really feel that more needs to be done in terms of training and building capacity, as you had said earlier, because these areas are very deficient at KPH. And these are patients based on demographics who truly cannot afford to go anywhere else. I mean, yes, this is really refreshing to hear from my colleagues that it is available at the primary healthcare level. But normally, when you see them in the second, at the tertiary level, where you're telling them that they have cancer, you're telling them all these various things, they're not coping in that specific moment. Some of them leave there very disheartened, and there's nothing. You try to counsel them somewhat, but they really need the attention
you
right there
can't.
and then. It cannot wait till
Mm-hmm.
2 months, 3 months. It needs to happen when I'm breaking the ice and I'm saying you have
Mm-hmm.
cancer. Because many times the patients come and they themselves don't even want to admit what they've been told. They will tell you, no, nobody told me that. I don't know why I'm here. And so, it's a big issue and it needs to be addressed.
Yes, and
Thank you.
sometimes it's actually denial when they don't really want to accept that this is what
Exactly.
is actually happening. But I thought Dr. Shetty was
Because they
operating
know their
out of
brain.
Dr. Shetty, isn't he still operating out of KPH?
I'm not
No,
familiar with
Dr. Shetty is
Dr.
in
Shetty.
primary care. He's
Okay.
with child guidance. He's a
He's with child
psychologist in charge
guidance.
of child guidance.
Oh,
We
okay.
have a
Yes.
Dr. Terence Bernard and we have a Dr. Chung. But
Oh,
it's very, very hard because they're not just catering to our department, it's the entire hospital. And sometimes they, as they had said before, they cover other areas or
Institutions.
localization. So institutions. So it's very, very hard sometimes to even get them when cancer patients are having a crisis. Some of them are already diagnosed with schizophrenia even before they have they're diagnosed with cancer. And so they decompensate. And it's very, very hard for them to comply with treatment, to do certain things. So I think it's really a area that needs attention.
Yeah, some
It
serious
is
attention.
so many of the areas. And I think to where this can be helped, because since coming into school nursing, well, 15 years ago now, I realized that psychologists, it is an area that is underutilized, or maybe it's because it's just understaffed. We
It's not
don't have enough
underutilized, it's understaffed. There are
understaffed,
whole, the need is there, but we don't have enough bodies to
and the
satisfy the
deployment.
need. Right.
But just like the government years ago and developed partnership with getting veterinarians when there was an issue, and we dealt with that. And we have done other things. We're putting in all these STEM programs and so forth. The need for psychologists can be addressed at the governmental level, in terms of getting persons trained, making it attractive, giving the grants and the scholarships and so on, and developing the programs to have more persons enter into it to get them trained. Because we have to be realistic. Some of the times why people say they don't have and they've never been told, it's their means of coping. Because once I admit, then the frustration, as we call it here, and so on, that's going to take place. Some people die within months, and it's not the cancer that kills them.
The mental state.
It's the mental state that does it. And even for the workers, so even for the doctors and nurses and the persons who have to interact with and break the news and hear and take on all of that from the persons, need somewhere to go to shell it down, to say, Lord, have mercy. You know, I had to do this.
Finish, just finish your statement.
And so it's something that I've seen, I've looked at, and we need them available to the public, but also to workers, to staff. We see it for the police force, we see it. We need these areas of high impact where persons need it themselves. Those who are the caregivers need to have that place, that confidential space where you can go in and you can unburden, because we certainly can't take it home. We can't take it home. You can't be talking. If you talk, you have to talk to other colleagues who are already have their own stresses. And so we need that as well. So it's right across the society. And that's something that government can do to help to stem that and to make provisions for that. I strongly believe that.
Thank you so much, Vanessa. And I believe that
me?
COVID-19 would have removed lifted the rug, and the whole business of mental health, I find, since COVID-19, it has been placed now on the front burner, and it is in the air, in the atmosphere, in people's face. So we are hoping that out of that, we will see the support system, the supportive environment that is needed. And I know that Dr. Wendell Abel is one of those who champion the cause for that on any platform that he's on. Even recently, at the end of the election, he publicly came forward to say that we have to remember that those persons who would have supported the Orange team, their party did not win, would have been suffering some amount of depression and all of those things. So it is being placed on the front burner now. So hopefully out of that, we will get the attention that is needed in that department so that we can have a healthy nation, because right now things are not looking good. So moving on, who did rising rate of obesity in children?
Good afternoon.
Good afternoon.
So, in terms of the root causes, I would say a lack of balanced diet, We know one that children dislike vegetables and most times have to be forced to eat healthy. And a lot of times with the fact that both parents are working as well, sometimes it's hard for them to have a home cooked meal. As well, home cooked meals and vegetables are more expensive presently. So it's easier to buy fast food, or even if they're buying cooked food, a lot of times it's a lot of rice and a piece of fried chicken because that would be cheaper than a food with a lot of vegetables or salads for the children. We know that they prefer sweet snacks and drinks. And even if it's not sweet snacks and drinks, it's a lot of salty, chips and so forth. So from the diet, that can increase their weight. And on the other side, there's a decrease in exercise and outdoor sports because even though the schools would put in a mandatory physical education period, before, more children used to be outside playing. When they go home, they're playing with the neighborhood kids, but more children are now inside on their laptops, on their cell phones, a lot of screen time, scrolling, watching shows. And we actually discussed this earlier. A lot less children are catching buses or walking to school than in the past, which may be due to crime or the safety, but all of that would contribute to obesity. So now that they are getting obese, this can lead to have effects on them developing diabetes early in life, developing hypertension, because we have some very young patients now in the clinics who have high blood pressure, and we're investigating hypertension in the young, and we're seeing it more and more. Elevated cholesterol, and as a result of the fact that they're already obese, they're already young, this makes it even harder when we're trying to now get them into exercising, increasing their activity and trying to send them back to eating healthy when all their life they have been eating unhealthy. It's a very difficult thing to do. So right now, for example, a lot of our pregnant patients are coming more and more obese, and a lot of them already have diabetes and hypertension. Some of them are in their early 20s. And we know that just obesity is an independent risk factor for diabetes. And then when they have gestational diabetes in pregnancy, that alone could increase their risk of getting diabetes within 2 years after being pregnant. Thank you.
All right. I'm not so sure why you ended up with the pregnant mothers though, because we're really talking about the children. I was hoping when you touched the pregnant mother that you would have mentioned the possibility of the children being born with the condition because of gestational diabetes with their mothers. Anybody else did that topic?
Yes, I did
Yes,
that.
I did.
I did
I did
also.
that one too.
All right. So I will take Kay first, and then who was the other person?
Simone.
I
I
also
will
did
do
that
Dana,
it.
topic
I hear a
also.
male voice.
Dana
I
as
also did
well.
that topic also, miss.
All right. So Marius did it as well. And somebody else?
And most of the things said already though.
I was about to ask if for the
Dana.
other persons who did it, if there is anything else that she did not mention that you had.
All
I
right.
do, but I will wait.
Yes. So in terms of the causes, she mentioned most of them. There are some children that are genetically predisposed. That is one. And some medications can cause obesity as well. So those two I have that she didn't
I told you
mention.
where to go.
In terms of
Don't have to
effect,
repeat myself.
in addition
Chris,
to the
Chris, we are
Yeah.
hearing you.
Okay. Sorry.
All right.
Yes, so in
Simone?
addition, in terms of effects, in addition to the non-communicable diseases that she mentioned, poor self-esteem and depression, obesity, you can get sleep apnea as a result of that as well. Joint pains, because of the weight and the small structure, the
children can have joint pains as a result. And of course, they are now susceptible to being bullied because of size. That's what I have.
All right. So one of the effect of it would be the bullying because of size. Simone, did you have anything different?
Well, the only thing I would add is I had a low self-esteem as one of the causes, and the low self-esteem again as one of the effects. So you see it happening twice.
Explain.
All right. So obesity in children, the rising rate of obesity in children causes one of the causes is low self-esteem, as persons sometimes eat because they are being bullied. Somebody mentioned bullying. Sometimes some persons, that's it, their comfort. So they eat a lot of food just for comfort. In terms of effects now, because the child gets fatter and fatter, bullying increases and the low self-esteem also continues to increase. So that was my thing.
Okay, all right. Vanessa?
I just wanted to add that most of the causes and effects I have as well. I wanted to have add an unsafe environment. So maybe that's a possible cause. Like maybe if they really would want to go out and increase their activity, perhaps the environment is not conducive, and certain lifestyle practices in the homes as well, coupled with the
Right.
unhealthy eating and the physical inactivity. So the environment also may not, if they're all in a high-rise building with limited yard space, or even if they go to school, they're perhaps not encouraged to participate in PE, because I realize these days PE is not really what it should be. Like it's not really structured again. And after you reach a certain age, maybe like third form, you focus more on CSEC and they tell you PE is optional. So you don't have to go to PE anymore. So the environment.
Thank you so much. I'm just enjoying these discussions.
Miss,
All right.
Miss, I think I do not know if they mentioned also the individuals, both adult and children, they are at higher risk of cardiovascular disease. And because of that, they also can have what you call metabolic syndrome. And because of the obesity and the high risk of cardiovascular disease, and with the metabolic syndrome, this can lead them to what we call, also can lead them to renal disease, kidney disease. So these are some of the symptoms they may have later on. So that's part of the effect or symptoms they may have also in the future.
Right. Some years
Oh,
ago, probably about
oh,
5 years ago, it was the National Health Fund. As part of their community outreach, they were going into some schools with some of their programs. And part of what they did in those schools was a survey. Not just survey, they actually did measurements. And one of the things that came out of what they did was that a number of children at the primary school level were noted to be hypertensive. And I want to believe that that might have been the platform on which the government is currently, out of the Ministry of Health and through the Nutrition Department, they are currently in school doing these oh Lord, that word won't come out right now. Those assessment, so they're doing the
Anthropometric.
anthropometric, right? It wouldn't come out of my mouth before. So they are now in some of the schools doing those measurements with thank you so much, Danai, with a view to addressing what is happening with the youngsters. They are also looking at the school feeding program and the policy to guide what is being served to the youngsters in these schools. Out of the Jamaica Moves program, you would have heard too where they talk about these sugary sweetened beverages, and a limit was placed on the amount of sugar that should be in any beverage that is being sold to the children at school.
so those policies are in the schools now? Because I
they
don't really see it happening.
The SSB policy has been in the school for many years now.
But
What
it's not being
happened?
enforced.
Well, the enforcement was taking place. COVID-19 came, and that might have caused us to slip back a little, but I don't know that it has been forgotten. And the Ministry of Education is mandated to do assessment, periodic checks to ensure that the schools are adhering to the guidelines that they themselves had signed off on. So it was not just a Ministry of Health thing, it was a joint effort between the Ministry of Health and the Ministry of Education. We know that challenges were there, and because some of the children, before they go into school, they would have stopped and purchased their sugar sweetened beverage, hide it in their bag and go in, because once they go in, sometimes the school would not allow them to go back out. The vendors were also being engaged in the discussion. The manufacturers of these sugar sweetened beverages were also a part of the stakeholders engagement, because efforts are really being made to reduce the amount of sugar in the drinks that the children are having. And they put it, because the research was there, the findings were there. They had a platform on which to really speak to these persons in terms of what is happening. So efforts are being made, but yes, the cases continue. And we also need to engage the parents, those who already gone through the gate and those who are yet to enter the gate. Because it's what we do in the home that set the foundation for a lot of what happens as they go out into the wider society. What do we do when we are introducing them to complementary food? What do we give them? Is that everything that we put in our mouth that they need to get, even though they are now eating from the family pot, depending on what you are eating. So it is from that
The
level that
portion
we need
size
to engage with
control
patients, so
important.
that transition can be a healthy transition, and so they would have developed a taste and a liking for the healthy option rather than the unhealthy option. So even at that level, we have to engage the parents.
Mr. Don,
Yes?
this is one of the points I had to contribute to the cause. Is one, cultural beliefs.
Mm-hmm.
Some family believe that a fat, or so to speak, overweight child is healthy, and they would definitely aim for that. I personally know patients like that. And as you kind of mentioned a while ago, the parental or family influence when it comes to dietary practices, because we have seen this over and over. And I have seen parents addicted to Pepsi, for example, and they started to feed that to the child from early. The child
Mm-hmm.
end up being, I mean, 3, 4 years old, I'm talking about, end up being addicted to Pepsi. And that's just one example. So the poor parental or family choices also increase the, high caloric food intake, which also contribute to obesity.
Yes, and
Right?
I didn't hear that coming out earlier in
Yes.
terms of that part of it, the transition from breastfeed milk into the complementary food. That's one of the root cause of what we are seeing, because it gave birth to other things.
You see,
Yes.
just to add to that, because that early introduction of infant formula, and not just complementary food, but there are kids who really do not need to take formula. I mean, mommy's well, mommy's here, mommy's available. And just because they would have seen the formula so, highly marketed, and
That's
other persons
status symbol
perhaps,
too.
yes, yes, that look, that identity, you have money, that kind of thing, you're not poor. So those influences also trigger the early, introduction and increase obesity.
So we are heading towards a very fat nation. And for some persons, fat is a sign of prosperity. High prevalence of domestic violence, especially against women and children. Who took on that topic? Nobody did? Class has gone silent.
Hello.
Yes, Tasha, did you
No,
did you take up
it
that
need
topic?
Yes, I did.
Okay, let's hear what you have.
So I say the causes of domestic violence, especially against women and children, are due to infidelity, cultural beliefs, personality or psychological disorder, socially immature or unstable, and anger issues. I said the effects are socially withdrawn or emotional trauma. So the women or children would feel this way. They'll feel a sense of fear and entrapment. They'll have post-traumatic stress disorder. We will notice that there will be some strain on the economy and strain on the healthcare system because these persons usually are armed and need medical care. And sadly, it may lead to death of these individuals.
All right, thank you. Anybody else touch that topic?
No.
All right, so Tashai, take us back to
Could I
take us through the root causes.
Okay, so when someone is emotionally unstable, right, then they don't know to regulate their emotion, and when they experience, and mostly it's against women. So I would now say the men. When the men are emotionally unstable, instead of generating this emotion, they will react and then become very abusive and hurt the child or mother. In the case of infidelity, if the mother is seen to be unfaithful or caught in irresponsible activities, then the man will become jealous, will become abusive, and cause harm to the woman. With cultural belief, they may feel that they have the right to control their partner. So in most inner cities, you will have men grow up feeling like, women supposed to listen to them. If them try to be like defensive to any commands that they give, then they will want to fight them and become abusive. And then the acceptance among younger ladies where they feel like, oh, if the man don't beat me, he no love me. So that is a rise as well, cultural beliefs. Anger issue tying with the same as emotionally unstable. Some person have personality disorder or psychological disorder. So this is a mental issue. Unfortunately, men may not so easily control themselves because it's a mental health issue, and unfortunately women may experience abuse in this situation because sometimes the man may feel irritated and cause abuse, and then another time that's not the case. So
All right, thank you so much for that. Class, is there anything else that you would want to add to the root causes of this situation?
I'll say that there
Yes,
is still
please.
some disparity in terms of ability to earn, especially in lower socioeconomic
Ah,
community. So you find that there are still men who are still the breadwinner. And so because that there's that disparity, there's also a power difference that makes women and children more vulnerable because they're dependent.
all right. Anybody else want to chip in?
Alcohol abuse. I would like to add in alcohol or substance abuse because you find it very common when persons abuse alcohol or they smoke, then they can more likely to get angry at little things, which would trigger them.
Okay. Anybody else?
Can learn behavior or the environment that they grew up in. I don't know if it's a possible root cause or learned behavior. That just came to me. I'm not sure if that
Yes,
would be
it
a
can be.
or
I
it
saw
can
my
be
father doing it to my mother, so it is
or
okay
it
for me
could
to
be
do it to my
right,
partner too.
right. It could be an effect to a child know thinks it's learned behavior um going forward.
All right. And some of the points I jotted down because I was listening for them. When you guys chip in, you actually mentioned them. So, all right. High levels of
Mrs. Walters,
Go ahead,
sorry. Yeah, I was just wondering also, could also religion also be a part of it too? Because you have some religious beliefs where the men are supposed to be in charge, and if the woman doesn't conform, they can become abusive and the woman cannot say anything. She has to comply with whatever. I am not sure. I'm just asking.
It's a very interesting question. Anybody want to take that one on? Nobody? The
I
whole
mean,
bit of the
I think
religious
it goes
belief.
back to what Nicole was saying about the power struggle in the household. And I'm not sure if any one religion promotes domestic violence,
Does
but
not. The
certainly
religion does
right,
not promote it.
but
But
certainly
the
the power
interpretation
struggle.
of religion probably could promote it if you're an extremist, because a lot of religions are very patriarchal, the man is the head of the household. So let's take, for example, the Islam religion. The man is the head of the household, and his wife and children should submit to him. And if it is a case where he's not submitting, she's not submitting to him, he might take it, based on the fact that the tenets are woman should submit to man. He might then take it upon himself to quote unquote discipline said woman for failure to submit to him based on the teachings of said religion.
My
But is
sword
it
is
the
drawn,
religion
Alex.
that promotes it, or is it their way of enforcing what they believe?
So religion doesn't promote it.
Brightness.
It's just that they interpret it as such. So it is an extremist perspective on what is there.
Okay.
Because Alex, I'm saying my sword is drawn, ready to do battle with you, because actually the whole
No violence, please. That's exactly what we're talking about, domestic violence. Come on.
Yes, it's but even if you look at even Islamic faith, and wider and Christianity that subscribes to the man being the head of the household, really though, no one committing domestic violence can claim that to be their platform, their source of inspiration, because if you so wholeheartedly subscribe to that faith, then you are also subscribing to the fact that this woman is to be protected by you. As she submits, you are the priest in her life, and as such, you must act in a space of protection and care. So you would never use that to then effect the violence on her. It is,
But
I
some
believe,
actually do.
society.
Yes, Miss,
They
that's the
are
reason
not to.
why.
They are not to, but some actually do.
So
Mrs.
they
Walters, that's the reason why I raised the issue, because I have heard of
But is it really the
cases
religion though,
It's
or
not
the
the
servants or
religion.
environment?
it's
pastors
not
and
the
they're abusing them and nobody knows?
No,
Because
So
the women
I
those
are
are
feel it's,
suffering
as
men.
you
in
say, it's to the
silence.
extreme.
The women
Right.
are suffering in silence. They
In
don't come out
silence.
and speak
Right.
out. Right. And all the faith is not just the Muslims, but all the faith have that issue with some of their parishioners. So
Right.
it's not just the Muslim, but in Christianity it's also very prominent there as well. And I know there are cases that I know of across different faiths, meaning different churches, not just one faith. So it is very much alive. And it's not just domestic violence, but even some of the children are suffering incest at the hands of their religious priests within the household. So some of those things do exist. How do we weed those out? We start when people start to speak up and speak out and name and shame the devil, and so we can deal with it. All right. Let us move on to high levels of crime and violence.
1 second. I didn't hear Tasha mention for the effects. You can have like poor, like for the child, they may have like regression, like poor in terms of education, like either absenteeism or they're just not doing well. In terms of productivity for the woman, maybe she have to miss work a lot, not really empowered to, to contribute in terms of working, like being a part of the workforce. I never heard she mention anything along that line.
All right, so thank you for adding to this storehouse of knowledge that is already there. So, but when we are finished, you should have some comprehensive thing that if you have to talk about this again, the information is there. You have a whole lot you can talk from here until next year about. All right, high levels of crime and violence. Who did that? Nobody?
Miss, I attempted that one.
Okay, Veronica, let's hear what you have.
All right, so for my root causes, I looked at poverty in the sense that there is overcrowding, hunger, lack of basic amenities, and earning money is limited. And so poverty leads to crime being very attractive. Because if somebody comes up to you and say, okay, you can earn $200,000 by just doing this, it becomes attractive when you don't have basic amenities to feed your children, when your children are hungry and crying. So poverty is one of the root causes. As I was saying before, inefficiencies in the justice system that allows persons to go ahead and just take their own justice. There is lack of dispute resolution skills. So persons are not able to resolve a dispute without resorting to physical confrontation. I looked at cultural practices. So within some spaces, if you're not tough, you're not regarded as being a man. And so you have to defend yourself, right? Or you're seen as being soft. So if you're not fighting and being a bully, then you're not seen as being a man or what a man should be like. Educational level. So the less educated, the lower jobs, and that in and of itself leads to poor job security. So you're bouncing around from one job to the other. I also looked at lack of respect for personal space. So you might be, and that can also tie into the cultural practices. So a lady might be walking on the road and as she walks by, you have persons who are hanging on to her and touching her, inappropriate touching. We have lack of sanctions when crimes are committed. So in the USA, you have like cold case files where 40 years later, you're being hunted and somebody's assigned to that case. In Jamaica, you just get rid of the witnesses and you get away with the crime in terms of corruption in politics and the wider society. So you have persons who are fighting for scarce benefits and spoils and corruption in terms of contracts and so on. Then you have a lack of sustainable job opportunities, and of course, the need for power. So power is a status symbol. Mental illness. Some persons actually are delusional or they don't know how to apply control. Inadequate policing. So you don't have a lot of police. So some areas, it makes the gap becomes more evident for a don to take over. And then we have persons also with lack of identity and belonging, and so they want to join up with a group. So some of the symptoms would be like the high murder rate, reprisals are high, you have murder, suicides, abduction, road rage, lottery scamming, gang, organized crimes, frequent fights, inability to have conversation and expressing thoughts without descending into arguments, stabbing at schools, antisocial behavior. Yeah, basically that's what I have.
All right. Anybody on the platform want to add anything to that? Hello?
I will add the family structure is an issue. We do know that persons who grow up in households where there is no male figure are at increased risk of many antisocial behaviors. So that was one thing.
Thank you. I can take that one off my list. Next. Lack of parental guidance. And if we're not careful, what is happening in our society now is going to trigger a whole lot more issues. So we take, for example, children are not allowed to develop, or they're not taught that respect for authority, and it starts from in the home. I don't know why as parents we feel that we must do some kind of overcompensation and children are allowed to say and do things and we let it go and they are children and they will grow out of it. It doesn't happen. The only thing that children grow out of is their shoes and their clothes. Other things become reinforcement when they are not addressed. And so we have to, and I'm not saying to beat them and kill them. No, that's not it. But children have to learn from early that there are some things that are just not socially acceptable. But I find that we have fallen short where that one is concerned. So even though there are siblings in the house, one is allowed to take from the other what is not his or hers, and it goes unattended to. And so they grow up with this whole thing of entitlement. And so when they go out into the wider society, even at school, they may see other students with something and they think that they need to get it. And if they can't get it, then they are going to take it by whatever means possible. And so as they grow older, you find that these kind of behavioral issues continue to manifest itself, and when they get to adult age, then it can transform into crime and violence. Because you're going to steal it because you think it is yours and you must get it. The person might want to defend it, and next thing you might kill the person when what they for what was actually not yours. We also have a digital generation that is coming up. This quick get rich quick syndrome. They don't want to stay in school and stay the course like we would have. They, as a matter of fact, before they reach high school, they think they should be earning their own money and they don't have any skills and any profession. But that kind of quick get rich quick syndrome is there. And I think that was what would have given birth to a lot of this, so many young persons being a part of the whole scamming thing that is plaguing our society right now. Some of them, they are young, and it goes back also to what you said about the parental issue within the home. Because I've heard a woman saying that no wrong with the scamming and the scamming thing and the money what they went thief from we in a slavery. I they pick them and take back. Hello? The persons who were in charge of slavery dead many years ago. The persons they are scamming now are mostly elderly persons. There can be no justification for it. How can I have a 16-year-old who never walk a day in their life? They drive one big Benz and they build one house give me for living. Where did he get the money? So that parental thing is also there. And you find that within that scamming world too, if money no share right, everybody dead. We have a case in Jamaica where 10 members of one family were shot because the scamming money never divide right. So we have also some of those things that are plaguing our society. And so when we look at what is happening, we have to start to take check of ourselves. What will I do within my household, within my circle, to ensure that all of these issues that we have been looking at does not attend to those around me or those coming out of my household. I know some parents are having some challenges. The children, they are going to school and don't really want to pay attention in a class. As a matter of fact, they only go because they have no choice. How do we address some of these issues? But I find that we have had a very rich discussion. I want to thank everybody who participated. It shows that you had done some homework. There was depth in what you presented, and I think that you are already on your way going places. So, and it shows that you understand the whole concept of how can we apply this problem tree concept to a topic that will help us to really understand what we are dealing with and what needs to be done if we are going to address the issue that is at hand. So it's not only just health related issue that it can be applied to, it can be applied to any other issue as well. So I thank you all for that robust discussion. It shows that the concept is understood and we are on our way to getting done. So if you see a question like it in the exam, nobody should complain. Right? Oh, Miss, give us this and I don't know what to do. No, 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 no.
Excuse
No.
me, Miss.
Go
There was
ahead.
one thing that I realized for the two last ones, the early exposure to trauma and the effects that it has on health outcomes in adulthood would have been consequences for both the domestic violence in homes as well as the general crime and violence in Jamaica. There are quite a few studies looking at how traumatic experiences in childhood actually affects health outcomes as an adult. And it's not just limited to mental health issues, but also NCDs.
Thank you so much for that. So we are getting someplace. All right, we have a few minutes left, so we're going to try and finish up that other presentation from the last class. I'm not so sure why I'm having so much challenges with sharing. Something is just not right, and I'm not so sure what it is. From current slide. All right, everybody seen
Yes, Miss, we're seeing it.
all right. So we would have looked at started looking at determinants of health, and unfortunately we didn't get a chance to do our class that we wanted to do today. That would have been so nice. But nevertheless, who knows, we might find a session where we can actually just sit down and do it. We'll see what happens. All right. I asked it to start from current slide. It did not. All right. So we are just going to backtrack a little bit and start from the social determinants of broadening our focus by looking at the whole business of wellness. I would have started this one already, and we did pass this one. And we had looked a bit at the whole business of physical wellness and the many things that would have influenced our physical wellness. We also looked at emotional wellness. Yeah. And at emotional wellness, we look at the fact that for us to be emotionally well, we have to look at the whole business of whether we are optimistic or pessimistic. And we can, there's a very famous thing that is used to look at that one is whether or not the glass is half full or if the glass is half empty. As a matter of fact, it's actually a psychological tool that they sometimes use to assess people's emotional level. We look at whether or not we have high self-esteem or low self-esteem, and know that can impact our health and well-being. Do we have self-confidence? Do we feel that we can actually do the things that are required of us? What about self-control? And so for some of us who like to enjoy some tasty meal, and we find that we are on the other side of the spectrum where our BMI is concerned, can we control ourselves to see it, want it, and not touch it? And so that we can get to that place where we want to be. Ability to share our feelings, whether or not we can actually open up to persons around us. And sharing one's feelings is a very difficult thing to do because it's like you become vulnerable. And one of the things I want us to keep in mind is that if somebody considers you a friend and they share personal things with you, even if the friendship did not last, try not to be the kind of person where, because the friendship is no longer intact, then everything that was shared with you become public knowledge. My grandmother always said, do unto others as you would have liked them to do unto you. And so anything you wouldn't want anybody to do to you, then do not do it to them in return. So we have to look at a whole business for peace of mind. What is it that will have us feeling that state of emotional wellness? What matters most is how you see yourself. And if you look at that little picture there at the bottom part to your right, it's actually a cat looking into a mirror, but the image in the mirror is that of a lion. So when we look into the mirror, who do we see? Who do we see when we look into the mirror? It's part of what helps to determine our state of emotional wellness. To maintain emotional wellness, there are some things that we actually need to do. We need to have a good attitude. Things may not always be the way we would have liked them to be, but it is the way we react to the things around us that is really going to make that difference. We need to try to be happy. See the good side of everything, even when it appears to be bad. And part of being happy is to be able to laugh at ourselves. I find that as people, when the shoes is not on our foot, it is easy to laugh and have mirth and have a whale of a time. But when the shoe is on our foot, then we find that we can't see the humor in the situation. But we need to be able to laugh at ourselves. We need to have friends. I know some persons say that they're a loner. They don't want no friend. But it should be told that we're all social beings. And we do need companionship. So we need to have friends. And when you are down, that is the time for you to get up. So if you can wake up one morning and your spirit feel a little bit low and you feel a little down, that morning when you are leaving your house, dress up. And I promise you that when you walk through that door, somebody is going to see you. They are going to compliment you on your attire, on the way you look. And that alone by itself is going to lift your spirit. And that down feeling that you had will just disappear. So always explore and monitor your thoughts and find solutions to emotional problems. And nobody is immune to emotional problems. All of us at some point in our lives will be going through these. So let us just manage them well. When we look at spiritual wellness, it has to do with possessing a set of guiding beliefs or principles or values that gives meaning and purpose to life, especially during difficult times. It has to do with our capacity to love and to forgive, to experience compassion, to find joy and fulfillment. And really, it's the antidote for anger, fear, anxiety, and pessimism. So spiritual wellness is all about meaning in life events, finding that meaning, and demonstrating individual purpose, and live a life that reflects your values and your beliefs. And there's an old saying that says that if you don't stand for anything, you will stand for anything, you will fall for everything. So we just need to have those core beliefs. What is it that is my philosophy? What is it that is my guiding principle? How do I stand firm on these, even when others around me may be going in different direction? When we look at interpersonal and social wellness, our relationship with others is often influenced by loving, supportive persons in our lives. But not all of us are thus blessed. Some of us have persons in our lives or in our inner circle who are anything but loving and supportive. Again, we have to go back to our emotional health. What are we going to do when we find ourselves in that situation to ensure that we maintain a good level of emotional health? Good communication skills are very important. And when we talk about communication skills, it's a two-way process. So there are times when those around us may do or say something that we are unhappy about, but we do not communicate how we feel to those persons. And so they have absolutely no idea that their expressions or their actions are causing us distress. If something is being done that you are unhappy about, open your mouth and say it, because unless you say it, the persons around you may not realize that they are actually affecting you in a negative way. We need to have the capacity for intimacy. And intimacy here does not mean sex. We're talking about having that one person or those two persons that you can share your personal thoughts and feelings with. Contribute to community life. The me, myself, and I team does not work. Am I a part of any civic or social engagement around me? Do I participate in things at work, at school, at church, in wherever, whatever area I am at? Am I somebody who is willing to participate, share with others, be a part of a team then that work towards the achievement of something? Team spirit is very, very important. In addition to the team spirit, we need to respect and have empathy towards others. Everything is not going to happen the way that we would have liked it to happen, but we still need to respect the other person. We still need to understand from their perspective. And so one of the things that I find that sometimes bring up most disrespect in us as human beings when we have election. And I mean, there's a reason why there are two parties running and sometimes four. It's because there's that freedom of choice. We're in a democratic society. But all of a sudden, if I am supporting green, me no want to see nobody no orange, and me no want to hear what them have to say, or vice versa. It does not help us. Each individual has a right to their feelings. They have a right to their opinions. And just like how we expect them to respect ours, then we need to also give ear to theirs as well. Another dimension of wellness that we must keep in mind is the environmental wellness. Really, really very important that we do that. And it refers to individual and community space influencing comfort. So when we talk about environmental wellness, it's not just these green spaces outside. It speaks to us being aware of the interactions between the environment, the community, and yourself, and for us to behave in ways that care for each of these in a responsible manner. So you talk about protection from external hazards surrounding your living and working areas and taking steps to prevent harm. And we know that some of us are in some workspaces that are toxic. They are overcrowded. And if you're not careful, you can actually harm yourself in the workspace. Some years ago, a medical doctor who was a part of the staff at the regional office actually tripped on some posters and broke her arm. Means that the environment was not contributing to her well state of being. Sometimes you go into some of these offices, the cabinets are there, and on top of the cabinet is Mount Everest. And then sometimes you wonder if there should be an earthquake, what in heaven's name going to happen? We talk about disaster preparedness. And all of these offices know that things like their filing cabinets are to be anchored to the wall. But how many offices has ever done any of that? And on top of that, anchoring them in the event of an earthquake, we pile them high with files and other things. So should in case there's a tremor, then some persons who would have made it out of the tremor alive may not do so because of falling debris, and those debris not coming from the ceiling, it is from right beside them from a cabinet. So you need to start looking at your workspaces when you go back to work and see how you may need to declutter your workspace so that you can have a safe working environment, and think about the same thing at home. It also ranges from food safety to levels of violence and peace. So all of these contribute to your to your environmental wellness. What are we having access to safe food? We talk about obesity in children, but even for us as adults, not all of us are able to prepare a meal in the morning to take with us to work for breakfast and for lunch. What is it that is available on the road for you to eat? How safe is it being prepared? And so our environmental health officers, they are tasked with the responsibility to go into these establishments and do their assessment to say whether or not they are safe, and the food that is being prepared is safe for human consumption. But you'll find that what can happen is that the environmental health officer, having gone in and done this assessment, would have given them a clean bill of health, but 2 days after that, things may have gone south because they were only doing that and preparing because the assessment was coming. So our environmental health officer, sometimes they may have to double back without warning, without them recognize that they are coming back, and sometimes that is when you catch the unsatisfactory practices that some of them are actually carrying out. Part of this too is that there are times when, as an officer, you'd have been tasked with your responsibility and you find that you are hindered in the process because of, and I put in quote, political correctness. And we can't overlook those because they are a real part of some of the challenges that you may encounter as you carry out the responsibilities that you have been tasked with. So we look at these, but there's also the whole business of intellectual wellness. It is the expert in anything was once a beginner. So where do we start? We need to be open to new ideas and have the capacity to question things and think critically. And when I look at this one and I look at our recent election, and we look at some of the debates that would have taken place, I think one of the things that we fail to recognize, and the political directorate have failed to recognize, is that the current generation that they are dealing with are critical thinkers. They are not like our grandparents and great-grandparents who they just decide that they are supporting this particular party. It doesn't matter, they don't stop, they don't listen, they don't think. They just want, you call them diehard persons, no matter what that party is doing, this is the one I am supporting. But the young voters that they want now to come to the table are these critical thinkers who are asking a bag of questions, and unless you can satisfy them, then they are not coming to the table. So the undecided portion, when we look at our voters, even here in Jamaica, it is widening. It is widening. It is widening. It is widening. So part of our intellectual wellness is our ability to have this critical engagement in our thought processes, to be open to new ideas, and sometimes we have to unlearn to learn. An example that I can use is the whole business of how do you support the breast during breastfeeding. Many years ago, they were taught to use their index finger and their middle finger as a supportive place. But we find that over time, we realize that when they press down, because of how those fingers are positioned, it was actually squeezing down on the milk ducts and preventing the flow of milk. So now we have to switch gears. And we are saying to them now that you use what you call a cup hold. So you support the breast between your index finger and your thumb. We are having a challenge because even some of the little young ones now who are just getting pregnant, doing what we call that scissors cut. Where did they learn that from? Are they now open to undo what was learned then and learning the new ways of doing this? And so we have to try to help them along that process. So intellectually, we should be able to put down some ideas and take on new ones. Motivation to master new skill is also a part of our intellectual wellness. So too is a sense of humor, our creativity, and our curious minds. It has to do with our ability to detect problems, find solutions, and direct behavior in a positive way. Now we turn our lens to occupational wellness. There are 5 benefits of occupational wellness. A great deal of demand exists for it. It improves productivity and performance. It lowers stress levels and burnout. But having said that, it can also contribute to stress level and burnout. It decreases presenteeism. So when we are occupationally well, we shouldn't have any problem with presenteeism. And presenteeism having to do with you being there physically in the workplace, but your mind is elsewhere. So you are not very, very productive, even though you are at work. It improves teamwork. So all of these things, if you're occupationally well, should be on where things are at. If, however, occupational wellness is not there, then we can see the flip side of all of these things taking place. So really, occupational wellness inspires us to prepare to work for work in which we will gain personal satisfaction and find enrichment in our life. Your attitude about work is a crucial influence for occupational development. If I should go around the room, ask for a show of hands, how many of you think that you're occupationally well? Anybody think that they are not occupationally well, and why? So we are all occupationally well?
Well, I wasn't. I miss. I wasn't when I worked in government, and so I had to run.
Anybody else?
Oh, miss, I'm not. I am not. I have leak. My office is leaking, and that is hazardous.
And I'm sure
Either I don't think they give us enough credit. They don't care for the caretakers, which is the nurses. So we have no proper stations, no proper coffee break room, nothing. So no, I am not.
So Cindy,
Yes, please.
what are you going to do to change that situation?
I always doing something. My voice is always heard. I know I put pen to paper and we try to make it, we occupy the rooms that they say we're not supposed to. Because I don't see why a supervisor, there's a room for a supervisor that don't be there. So we utilize the space.
All right. Is it possible for you to have a little committee that is formed that really champion the cause for this? Because we have power, but sometimes we don't use it.
But that's the thing, everyone wants a change until it's time to champion the cause for the change because they're afraid of victimization and all these things. They don't want their name to be associated with, because we live in a small island that is very politically driven and controlled. So everyone wants to change, but when time for a change, they don't want to be anyone in the forefront. They want everybody else to do it for them. And sometimes that in itself is a challenge.
And it goes back to something that I would have shared in our orientation when we're looking at group dynamics, that there's a job to be done and anybody thinks somebody could do it, but nobody did what anybody could have done.
Yeah, and then the one that championed the cause, you're labeled now as the troublemaker, the instigator. You have all kind of different titles they would give you when you're alone pushing. But as you say, it's better for stand for something than accept anything.
And Cindy, it's not common to just St. Vincent. It's something that happens globally. It's something that happens globally. That everybody wants to see the change, but not many are willing to lead the cause to get the change that everybody wants to enjoy. And if we look at our forefathers and those men during slavery days, if they had taken that position, they would still be in slavery. But somebody stepped to the fore. Some of them offered their very lives up, and they never enjoy the change that they fought for, but others are left behind to enjoy that. So these are some of the challenges that we do have in the workplaces where voices are there, but sometimes the voices are not heard, and we suffer in silence when if we would have spoken out, then who knows, change could have come to us. I asked about occupation, when somebody first said that when they were working in a particular place, they were not happy. And to be honest with you, I was one of those persons that reached a point where every Monday morning, I wish it was still Sunday or still the weekend. And then I have to be repenting shortly thereafter, telling God that I do thank Him for having a job, because there are so many persons who are unemployed. So it's that I don't appreciate if I have a job, but I was just not enjoying having that fulfillment, that satisfaction at the end of each birthday anymore. And so when the opportunity presented itself for me to change career path, I did so, and I'm happy for the opportunity that had presented itself, and if that I did make that move. I'm not encouraging anybody, everybody to go and change their work, but then you have to think about yourself, your mental health. If you're not getting that satisfaction in a space where you're spending most of your waking hours, then you need to start looking at what needs to be done so that I can be mentally well. Because when we're not mentally well, then a lot of things happen that ought not to happen in the workplace at all. So we have to think about some of these things as we look at our occupational wellness, as to whether or not we are where we ought to be in regards to that. Occupational wellness allows you to explore various career options and encourages you to pursue the opportunities you enjoy the most. We need to have satisfaction in our job, because that is what gives us that. As I said before, we spend more of our waking hours at work. So we need to enjoy what we are doing. We need to find satisfaction. This dimension of wellness recognizes the importance of satisfaction, enrichment, and you need to find meaning through work. Self-reflection and occupational needs, we need to think about those. What occupational tasks do you enjoy? What occupational tasks do you find burdensome? What can be done about those that you find burdensome? We need to explore paid and unpaid work and volunteer opportunities that are of interest. So though you need to get your paid job, you may find that there is something that you may not be getting paid for, but you find satisfaction in doing it. That can also be a part of your daily routine, because that level of satisfaction sometimes can help to balance out the dissatisfaction that we may have in other areas. Practice open communication and proper conflict management with your colleagues. One of the worst things that could ever happen is to be working in what you call a toxic environment, where you do not get along with your co-workers and you have no choice but to be there on a daily basis. That alone itself can cause mental stress, and we don't need that, because with the mental health issues can come other issues, the diabetes, hypertension, and all of those things. Set realistic career goals for yourself and constantly work towards accomplishing these goals. Do not make those goals too high. So if you are now 40 years old and you don't have this 6-bedroom house yet, you may now want to think that you need to scale down the size and think of a 2-bedroom instead, because you have to think about the mortgage, how many working years you have left, your current salary, how much can it manage in terms of mortgage payments. So we need to set realistic career goals, so that when we do that and we look at what else we need in terms of our personal life, those career goals now can help us to achieve what we want in life. So you are now working as a nurse. You might be aspiring to become a matron. What is that you need to do to reach that level? Put things in place and take it one step at a time. You can't tell yourself that in 2 years I'm going to be a matron when there are 10 other people in front of you with more years of experience that may reach that level. You're not going to get there in 2 years. So whatever career goals you are going to set, they need to be things that are achievable. They need to be realistic, and you are going to work towards them constantly. For some persons, They may get a push start. For others, they have to take it slowly, one step at a time. And these career goals, as you achieve them, are what will help you know to achieve your other personal goals. So that big house that you want is that career goal, that advancement, that increase in salary as you go along, that is going to help you know to be able to afford a mortgage to get to that personal goal that you would have had in mind. So on a lighter note, mall maintenance shop. We can repair anything, but then there's a little footnote that says, please knock hard on the door, the bell doesn't work. Are you seeing the conflicting statements? If they can work on anything, why is that they can't fix the doorbell that helps us to get into their establishment? As we continue, as community workers, be mindful of some facts. Focus on one area of community health development without seeing the bigger picture is short changing the community. We can't be so focused that we don't see. We cannot keep our eyes focused on just one tree. We need to see the entire forest for us to have an appreciation of the broader picture and what we need to be done. So as community workers, that is something that you have to keep in mind. Individuals have various concerns and life interests and needs. Unless we meet them at their level, it is more difficult to engage them and influence change in their lives. Sometimes we go in as the experts and we know all of these grand things, and this is what I see happening, and we go in there and we just start, do this, do that, don't do this, don't do that. But no, we need to find out where they're at and then work with them at the level that they are at. And when we look at the health belief models, it will help us to flesh that out some more. We have to understand the stages where persons are at and how willing and ready they are to change from that stage and move on to the next stage. So it's called readiness for change. So we have to understand where people are and work with them. We are at the level that they are at. People have a right and duty to participate in activities that affect their health and well-being. Sometimes, again, as experts, we think that we know everything. And so we sit in our offices and we plan a program and we go into the community. And because we're bright and we come out there to them with this thing, they must just accept it and run with it. No. There's conventional wisdom in every community. Engage them, work with them, because often they already know the solution to the problems that they already identify. They just need some support to actually put in place what needs to be done. Promoting health means making healthy choices easier choices. But I find that we promote health, but the healthier choices are never the easier choices. If you really want to eat healthy, your pocket have to be very long or deep, because healthy choices are very costly. We are promoting something to a population that we are not providing a supportive environment for them to achieve that which we want to see them achieve it. If you go into the market, how many persons can afford to have 5 servings of fruit and vegetable on a daily basis? It's not that they don't want to, but affordability is a major problem. This will include but not be limited to educational experiences, because part of what we have to do, and then I will tell you that we have now to be teaching people how to read the information on the packaging, the food labels. What does it mean when you see these things on it? We know that because they have been hitting out against it too much sugar, some of the manufacturers now have resorted to using artificial sweeteners, some of which are said to be carcinogenic. How do we help people now to understand that you need to read the label, see what is there, and then make a decision based on your knowledge and your understanding of what is there. So we have to increase the educational level of people where certain things are concerned, to help them to make that decision that is going to work towards their health and their well-being. There are entry points for health promotion. When we think about health risk, if there is no risk to the population, the kind of prevention that we are going to be bringing to the table actions to avoid so that you do not become somebody who is at risk. So if you look at some of the campaigns that will be coming out of the Ministry of Health, some of them are designed for prevention of persons having the condition in the first place. So like know your numbers. It's a mixture there because when you go to know your number, some person may already have gone over the line. Some persons are in the safe zone. Then you are going to want to encourage them to do that which is necessary to remain in that safe zone. If there are no signs or symptoms of their health condition, we have what you call primary prevention kicking in, where you are going to be educating them. You are going to talk to them about preventive actions to reduce the possibility of them becoming ill at the other spectrum of the wellness continuum. If disease and illness and injury is already there, then we are going to be moving for secondary. And part of the secondary in disease, illness, and injury that you still want to prevent, even though they might be prevent complications, even though they may be showing a few signs or symptoms. So you talk about early detection and treatment. So we can look at the reason why we encourage women to have their pap smear or to have their mammogram done, and we'll encourage men to go and have their PSA done to detect whether or not there are any changes and they may or may not be developing prostate cancer. So that's early detection, because the earlier we identify what is happening, it is the more likely that the treatment will put a stop order, for want of a better term, or prevent them from advancing to the illness itself. So early detection and treatment is good, and the earlier you detect, is the more likely that they will respond to the treatment that is going to be prescribed. Disability impairment or dependence. When persons are at this level, we talk about now tertiary prevention, and we need to look at measures for rehabilitation and the restoration of functionality. And the last one there's absolutely nothing that can be done if that is a status where persons or some person would have reached. That the only thing you can do at that time is for interment. Nothing else can be done. The question, can you think of an intervention in any setting designed to foster good health? Anybody can think of one and you want to share quickly? Nobody can think of an intervention?
When they're asking for the labels to be on the food, like the high sugar, high fat, the black labels on in the octagons.
And that's a very interesting one, because I know that Heart Foundation has been at the forefront, champion this cause. And they were supposed to sign off on these in a Caribbean wide setting meeting. And Jamaica, who has been at the forefront champion this cause, were very close to signing. And then when the day of reckoning came, they did not sign. And Heart Foundation is hopping mad. And they have publicly said it, that the reason why Jamaica did not sign was because of political interference. And they have publicly said it, and they are not backing down. And so we do have sometimes when the intervention is here, if that political will is not there, it becomes a stumbling block and an hindrance in things, in it helping us to advance and do what we need to do. Talk to me about this little cartoon that I have there.
It looks like she's sufficiently motivated
To do what?
to exercise.
What is the source of the motivation?
Of the hardworking individuals.
You think it's
She's
hardworking
she's
individuals?
observing the men, the naked men in the gym.
So our motivation, is it the hardworking men are?
It's for her to see what is happening there.
You want them to out her fire.
Is a dimension of wellness that was not mentioned in Travis lineup? Come on, guys, we're adults. Come on, talk to me.
It's the physique of the men that motivates her, Miss.
I think it goes to show that we all have different motivators that would make us push to do certain things. So unless we are properly motivated, then we will not get up and do anything.
And so grandma is not really out there for the purpose of exercising.
Nah, man.
It is what
I
is happening at
can-
the top of that fire station that is of interest. And
Yeah,
who?
you have persons who are extrinsically motivated and those who are intrinsically motivated, and she clearly is extrinsically motivated.
I wonder what her husband would say if he finds out what her motivation
Him
is.
in the grave.
The husband might be motivated to join them and look so.
But grandma is very much using the trampoline, and so each grandchildren not getting a chance to use the trampoline. I found it to be so funny. All right, this is my last slide. And here is my nuggets for you today. Never give up. You have started this course, and as the intensity increase, some persons may feel that they should discontinue. But if you look at this picture, what is it saying to you?
Don't give up too soon because the end is very near. So keep trying and keep pushing.
It says
There's a great reward for hard work.
Great reward for hard work. But if you had just struck that thing a few more times, so you can see, imagine where he's coming from, and then when he reach at that point, and sometimes it happen to the best of us. We just reach that place where we just feel like we cannot go one step further. But if we had just made that one other step, we'd have achieved what we have been working so hard for over that period of time.
sometimes the breakthrough is right there.
The breakthrough is right there. So my nugget for you this afternoon is that never give up on yourself. Never give up on your goals. When the going get rough and the going get tough, press through your press. Keep going. Don't step back. All right? And I believe this is where we end our class for this evening.
Thank you, Miss Walters.
So do have a good rest of the evening. And since you're all home, I assume, or some person may still be at work.
Still on the road, you know.
Safe journey home.
Take care, Mrs. Walters.
Yes, I had to hijack it to get home. I don't even know if current came back on campus or what time it did, but I didn't want to run the risk of staying and not having any electricity to do class. So
Have a good night, everyone.
yeah, but I have a meeting that starts at 7:30. And it's a face-to-face meeting and it's not at my house. So have a great evening, everybody.
Have a great evening.
All right.
Take care. Bye, Mason. Thank you.
All right. See you next week.